to the Minister for the answer. Moving on to something that's connected often with addictions is topic of mental health. This was addressed earlier with the staggering numbers, the increase in the number of youth receiving mental health care, and as was mentioned, this goes across the whole population really. The Department of Health reported a 46% increase in demand for mental health services last year. And I know you can't raise the budget by that amount. However, it only increased 2.6%. And I'm wondering how the Minister will be addressing the increased needs for mental health support. I believe the Minister said that it's not that the money's there, it's about finding people. But there's a lot of ways that mental health support can be offered, not just with psychologists, and I know there's shortages for some labor, but I know that, for example, in schools there are people who are available, like MSWs, who could provide support with sort of different models of providing support, not just the traditional one. So I'm wondering what funding and programs are available, and what's the plan to address this level of increase? Thank you.
Thank you for the question, and you're bang on. We've got to do other ways than just the one-on-one with a person there. There's got to be a more of a greater support group. Interesting about the increase in demand of 46%. Well, you're quite correct about that. And we talked about the need to find people to fill positions. Last year, the department had $4 million available and unused, budgeted and approved. Couldn't find people for the positions. So it is, again, the seriousness of where the province is headed in terms of staffing. I mean, when you think of it, I wouldn't have thought $4 million budgeted, approved, and unspent because government couldn't find someone with the ability and training to spend that money on. And that's a terrible tragedy, and it's a terrible symptom of what we're facing in New Brunswick going forward. The other thing that you're correct on is it has to be more than just, if we have this HR problem, we need to take some of the lower issues on telehealth and e-health and access. If they're going to have access to the web and the computer and everything else like that, then surely we can access that to some positive, constructive things that can help them and help them in groups and things of that nature. So you're right that we can't budget necessarily to keep up to 46%, but the irony to that is we didn't spend the money that we'd even budgeted because we couldn't get the people to do it.
Thank you, through the chair, to the Minister for the response. And I wonder if there could, I know sometimes when money is budgeted and earmarked, it has to be spent on a certain thing, but I wonder if there could be a creative way to spend it in other areas, because I know there are community groups working on mental health. I know there are trained counselors and MSWs who want to be able to provide more mental health services in the community, and they don't have funding. So if there's $4 million sitting there, I know where it can be spent very well to support mental health. So I would be very happy to point you in the right direction.